If you imagine that you want your fluid to go out and down. I have Danielle here, and this is going to be kind of an instructional video of how to do your own lymphatic massage after surgery. Key is just to go really gentle. And before we do a little demo, let's peek at a diagram of your own lymph nodes. This is a fairly accurate representation of your different lymph node basins. You have hundreds of lymph nodes, thousands in your body, and they kind of form little clusters or basins. And that's where the fluid flows into your lymph system. Eventually, all those lymphatic channels converge and dump into the venous system, and then it gets pumped into your blood and heart and whatnot. But when we think about the lymph nodes, you have some lymph nodes up in the cheeks, and then they start to really condense in front of the ear, behind the ear. You have lots of lymph nodes that are under here, down the sides of your neck, and then even into this area kind of right above your collarbone. So keep this image in your head. We're gonna start off by kind of priming these different basins. You're gonna start by priming the lymph nodes right above your collarbones, kind of right like Danielle's doing. So you're just gonna kind of gently pump that area 6 or 7 times, and it's nice and gentle. Then you're gonna come up right beneath the jawline and just kind of gently press and kind of warm those lymph node basins up. 6 or 7 times. Then you're gonna come up in front of your ear, just like Danielle's doing, and kind of gently press and kind of get your system warmed up and primed for the lymphatic massage. And I think the key is to just be super gentle and not pull against. If you think about, we're lifting and repositioning tissue, so you always want any pressure to go with the lift. After you've got things warmed up, Danielle's going to show the actual lymphatic massage. You're going to start under your chin, fingers along the jawline up to the ear, and then down. And again, you're just going to go really gentle, maybe 6 or 7 times. It's probably easiest to do one side at a time. So after you do under your chin, then we're going to jump to the lower part of the face, so you can start at the corner of the mouth and just go out to the ear and then down along the side of the neck. See how she's using a couple fingers, just really being gentle to gently pull that fluid out and down, like 6 or 7 times. Again, one side, then the other side. Okay, so we've done under the chin, the corner of the mouth. Now we're gonna come up to the under eye region. So just really gently with your fingers, you're gonna come out and then down the side of the ear and down the neck. One side, maybe 6 or 7 times, just like Danielle's doing. And then lastly, we're gonna do right above your brow. So you're gonna start kind of right at your 11 lines and go along the forehead over to the temple, in front of the ear, and then back down along the side of the neck. Again, about 6 to 7 times on each side.